Now I have the pleasure of introducing Dr. Philip Moon, who is a professor of healthcare and nursing science at the University of Leuven in Belgium, and also visiting professor in Gothenburg in Sweden.
Thank you, Ashley, for the introduction, ladies and gentlemen, dear colleagues. Bundles and pathways, what is the evidence? That is the presentation that I would like to give today. And you will see that some of the analogies that have been made in the previous presentations will also come up during my presentation. I have no disclosures, but I would like to acknowledge two people that are really inspirational to me when talking about bundles and pathways. And this is Martin Elliott from London and Ed Hickey from Toronto. Both are cardiac surgeons. No surprise that they know what a risky business healthcare can be and why bundles and pathways can play a role. Ed Hickey is quite often using the analogy with aviation, and this is what we also heard this morning. And Martin Elliott is indeed often using the analogy with Formula One. And let me show you a brief clip on what a pit stop in Formula One could look like. Wasn't this great? Wasn't this beautiful? And some people may immediately ask, like, but what is the relevance of looking at Formula One when talking about healthcare? Well, this is indeed what you just saw. And this is how your patient looks like. And again, this is also the analogy that Lisa showed in her presentation. A patient at the ICU looks like this. On one hand, in the Formula One, you have the car and a lot is going on around the car. At the ICU, you have your patient and a lot is going on around that patient. And of course, sometimes things may go wrong. As in all industries, something can go wrong. And the NHS Institute for Innovation and Improvement developed this kind of matrix that helps us to see how safe or how hazardous a certain activity or a certain industry can be. And when you have a lot of lives lost with a relatively low number of encounters, then that industry, that activity is considered to be very hazardous. On the other side, when you have little lives lost with a lot of encounters, it is considered to be ultra safe. So when you have one life lost or less on 100,000 encounters, then it's considered to be ultra safe. Then you have the more regulated activities and industries, and then you have the hazardous industries, where you have more than one lives lost per 1,000 encounters for each fatality. How are the different industries, how are the different activities distributed over this picture? It looks like this. Scheduled airlines, European railroads, nuclear power are ultra-safe industries. Chartered flights, chemical manufacturing and driving is within the regulated zone, but you see driving is the most dangerous within the regulated zone. And mountain climbing and bungee jumping belongs to the hazardous activities. Where is healthcare? We are here. So this means that healthcare is an extremely hazardous activity and industry, a high likelihood to die. So
let's come back to this picture because one of the reasons why healthcare is such a hazardous industry
can be found here. I said a lot is going on around the car, a lot is going on around the patient. Well, indeed, dozens and dozens of processes are simultaneously going on around that car, and it's the same with our patients. So in fact, it's all about processes. And we learned from Paul Batalden that every process is perfectly designed to achieve exactly the results that it gets. When you have very good processes, it will end up in very good outcomes. When you have poor processes, you are bound to have worse outcomes. The attention for the processes started in the 1950s. It was at the time that the NASA was starting to develop vehicles to bring satellites in the orbit around the globe. And you can imagine develop a rocket like this, thousands of processes that needs to be streamlined. At that time, they started with working and started to use the term critical pathways, the flow of the different processes. It was in the 1980s that this kind of thinking ended up in healthcare. And at that time, the term clinical pathways was used. By now, different terms can be found in the literature, clinical pathways, critical pathways, care pathways, integrated care pathways, all have the same underlying principle and underlying idea, to streamline the process to align what is happening. The definition of a clinical pathway is a structured, multidisciplinary plan of care designed to support the implementation of clinical guidelines and protocols. And sometimes you hear people that say, well, this is our clinical pathway. Is this true? Well, in fact, a clinical pathway should have certain critical attributes. And one of that is a timeline. There should be a timeline in a clinical pathway that is indicating what activities should be done when. The activities and interventions to be undertaken, obviously. Also outcome criteria. What do you expect from this clinical pathway? What are the outcomes in your patients? And finally, a variance record, analysis of deviation. There are reasons sometimes to deviate from the pathway. And there needs to be room to argue, to indicate why was a deviation of the pathway appropriate. So if you take these criteria together, you can say that the picture that you see here is more a kind of a flow chart rather than a pathway. A pathway is more likely to look like this, where you have the timeline, where you have the different activities. It's indicating who is doing what, when, how, and with what results. The aims of clinical pathways are sixfold. To facilitate introduction of guidelines to improve the quality of care, to improve multidisciplinary communication, to reach or exceed the quality care standards, to decrease unwanted practice variation, to improve patient-clinician communication and patient satisfaction, and finally, to identify research and development questions. The subtitle of my presentation was, "What is the evidence?" Well, in 2010, a Cochrane review was published indicating the effectiveness of working with clinical pathways. And it was found that clinical pathways had a significant effect on in-hospital complications, improved documentation, reduced length of stay, and a reduced hospital cost. It did not show any effectiveness on readmissions in the hospital and in-hospital mortality. In the next presentation, Marta will touch more on clinical pathways and how you can work with these clinical pathways, how you can develop them to come to these good outcomes. Let's switch to the care bundles. And let's switch to the metaphor of aviation. This is a picture that you all know. It's the US Airways flight that landed on the Hudson River with the good outcomes that we all know. And someone may ask, what is the one thing that the pilot did to come to this result? Well, there is no one thing. This pilot had to do a lot of things. Make sure that the nose was pitched correctly, wings were leveled, the speed was correctly to avoid stalling, and so on and so on. All these kind of activities were kind of bundled to come to this outcome. And that's the idea of bundles. The term care bundles was initiated by the Institute of Healthcare Improvement. And it is defined as a small, straightforward set of evidence-based practices, generally 3 to 5, that when performed collectively and reliably have been proven to improve the patient outcomes. And it was at the end of the 1990s that the Institute of Healthcare Improvement developed, I think at that time, a dozen of these care bundles, and they implemented this in their 100K lives and 5 million lives campaign. The Institute of Healthcare Improvement truly wanted to save 5 million lives from harm in the American population in a certain period of time by using these care bundles. And the care bundles pertained to these elements: prevent pressure ulcers, reduce MRSA infection, prevent harm from high alert medication, reduce surgical complication, deliver reliable care for congestive heart failure, get boards on board, deploy rapid response teams, prevent advanced drug events, improve the care for AMI, prevent surgical site infection, central line associated bloodstream infection, and ventilator associated pneumonia. I'm sure that most of you do recognize these things, and these things are also relevant for most of you. For each of these bundles, an extensive document, an extensive how-to guide was developed. And I just want to show you one of these how-to guides. It's the example of how to prevent central line associated bloodstream infection. You see how to screen, how to detect, how to prevent, and what are the activities that you should do. 3 to 5, remember from the definition. And indeed, for this care bundle, there were 5 steps to be taken. First, use proper hand hygiene. Everyone who touches the central line must wash his or her hands with soap and water or an alcohol cleanser, even if gloves are worn. Wearing maximal barrier precautions, so the inserter need to wear mask, clothing, gloves, and so on. And the patients should be covered with a sterile drape. Cleaning the patient's skin with chlorhexidine, finding the best vein to insert the line, and checking the line for infection every day, but it should only be taken out and not on a regular scheduled basis. All these things are so self-evident, but quite often we do not use them in combination with each other. And that's the strength of a care bundle. You have to do all these 5 things, and that's how you can avoid these central line infections. So, if we really want to move healthcare industry out of the red zone to make it less hazardous as it is today, we need to work with pathways and with care bundles. So let me come to the conclusion. Healthcare is characterized by thousands and thousands of complex processes. What we know from Paul Patelden, every process is perfectly designed to achieve exactly the results as it gets. Healthcare is a hazardous industry. Clinical pathways are developed to optimize the processes of care, and the care bundles, in their respect, are sets of limited numbers of activities that together reduce the mortality and morbidity. And sometimes people say, well, bundles, pathways, isn't this a hype? Well, no, it is not a hype. There is a high need to work with this. Thank you very much.